COVID-19 infections and deaths continue to rise. Limpopo has recorded 238 more COVID-19 related deaths, making its total since the pandemic began, putting it at 977. Dr. Mkhize's visit will start at the Tshilidzini Hospital in Thohoyandou. From there, he'll go to a local mall that has previously been described as a super spreader location. The minister will then move to the Waterberg District, where he will visit the Modimolle MDR-TB facility, which is currently being used as a COVID-19 high care facility. Our reporter Pimani Baloyi has more on that story.
We're at the Tshilidzini Hospital in Thohoyandou, Limpopo, where Health Minister Dr Zweli Mkhize is expected to start his day-long visit to facilities in this province to monitor how the healthcare sector is performing in terms of caring for COVID-19 patients. The visit comes at a time when last night's statistics revealed that Limpopo ranked second in terms of recording deaths in the last 24-hour cycle. But to speak more about these deaths and the minister's visits, we're joined by Health MEC Dr MEC, first of all, take us through the program that the minister is going to go through today.
Morning to all your viewers out there. What we can indicate is that the minister will kickstart his visit here in Waterberg District, Tshilidzini Hospital. Will also move to Modimolle. We have seen what Modimolle has done to us during the festive season. It has become our hotspot. It was one of the center of spreading the virus. Will also move to Thohoyandou Health Center. This is one of the health center which initially when it was built, it was supposed to be a hospital, but now we want the minister to also intervene on that particular project because infrastructure around this area, it's also a national competency. We'll then move to Waterberg. You know that even the president has declared Waterberg as one of our hotspots after Capricorn District, where he will visit Mokopane, which is a regional hospital where we do have specialists, where patients are being referred and complicated cases are dealt with. He will also visit our MDR high care facility now, which is dealing with all our COVID-19 patients that are complicated. They are being referred there. So we'll have to take him through all those the facilities.
And MEC, last night your department released a statement talking about how there have been delays in terms of capturing statistics. And we've seen when the national department then released statistics, we saw that Limpopo now had 238 new deaths in the province. But your department says these deaths occurred from August up to now. So should the members of the public be worried that, you know, there's a delay in releasing statistics? There could be more deaths than currently what we're being told. What could have been? I understand this is not your competency. What should we read from this?
I think what you need to appreciate, and also the public, is the fact that when death occurs, there are a number of processes that are being followed before you can declare. It's not as easy as somebody who has tested positive, get sick, get complicated, admitted in the hospital, demised. That is a clear, those are the ones that we are reporting on a daily basis. But there are patients who undergo postmortems. There are patients who died even on the theater table. But during the postmortem, we take swabs and the results came late. There are people who demise at home. And when we take undertakers call us, we do swab them. And these are some of the patients. And also, there are patients who just arrived in the hospital and died on arrival. And if you look at the 238 number that we released yesterday, 160 of those, it's just the private facilities, which is also another challenge in terms of the reporting. You will see, for example, Tzanini Mediclinic had recorded around 50 cases. These are not the cases that happened on one day. These are the cases that, if you remember last, when we were in Kensani Hospital, people were saying you can't say only 15 people died in Kensani, but there are many funerals that are held in Guyana. So when you look at that 50 of Mediclinic and you break it down, it has happened during the December month, and some of them we can link to those cases of Guyana which people felt were not reporting. So they must understand that when we do data, we must do quality check. We have our M&M meetings, our peer review meetings, and then finally when the NICD has captured, we'll therefore report those numbers.
Thank you so much, MEC. That is the MEC of Health here in Limpopo taking us through the program that Minister Mkhize is expected to go through. But for now, it's back to you in studio.